terrified of forgetting to do that. That would be the worst. But I think we are all set. Do you have any questions for me before we start?
No, do I need to hit got it? Let me see. Got it. Okay.
Oh,
Nope.
yeah,
I think we are good to go if you're ready.
I'm ready. Awesome. Let me put our start time so I can keep track. All right, here we go. Hi, everyone. Welcome. I am super excited for my guest today. We're going to be talking about understanding autism through a neurodiversity affirming lens. Really quickly, since this is available for ASHA CEUs, what we're going to be doing today is first talking about introductions and backgrounds. Then we'll get into a discussion of neurodiversity affirming practices. We'll talk about the different therapy approaches that you can consider. We'll talk about writing functional goals. And finally, when it's important to consider augmentative and alternative communication. So if you're not familiar with me, my name is Vanita Lipback. I have a passion for AAC, assistive technology and literacy. I've presented poster presentations at ASHA. I used to be an AAC consultant for a device company and a school district assistive technology specialist here in Florida. Now I am a part-time teletherapist, AAC consultant, and host for Speechy Side Up. And my other job is now being a mom to a little over a 1-year-old. And I just decided at the beginning of this year to do a triathlon at the end of the year. So we'll see how that goes. It is a sprint triathlon. If anybody's familiar, so it's like the easiest one that you can do. But yeah, that's what I'm doing in my free time. And here's my guest, Carrie. Will you go ahead and introduce yourself?
Sure. First of all, I want to say thank you for having me on. My name is Carrie Ebert. I am a pediatric speech language pathologist in private practice in the Kansas City, Missouri area. I never have and never intend to run a triathlon, so we do not have that in common. I specialize in the birth to 5 population. My real passion is with the birth to 3 population. I've been an early intervention provider for over 2 decades here in the state of Missouri. What else can I tell you? I am a parent of an autistic son. Aaron is 17 years old. And so that just gives me the very unique perspective of being a speech language pathologist, but also being able to engage audiences as a parent of a neurodivergent child. So my son has taught me an awful lot, and he is really my inspiration for everything that I do. So that's kind of my story.
Well, thank you for sharing that. And he's taught like the world of SLPs so much as well, because you've been sharing a lot of like personal anecdotes and just things like you said that you've learned from him recently. Did you start off with sharing personal experiences with your son, or did you start off with sharing like your early intervention stuff?
Yeah, I got to tell you. So what year is this? 2022. I started professional speaking. That's when I started my professional speaking career in 2009. And I will tell you, nobody knew I had an autistic son. I didn't talk about him. I never, ever spoke on the topic of autism. I've always been an apraxia specialist. And it has just been, I would say, in the past maybe 5 or 6 years where I'm like, you know what? I'm ready to talk about Aaron. So you have to understand that when my son was diagnosed back in 2006, that was a time when autism was considered a tragedy. And so it was talked about in negative ways. The purpose of therapy was to fix autistic children and make them act more neurotypical. So it was a very difficult time for me, but I will tell you now, he is just such an inspiration, not only to me and my family, but to all of my followers as well. He continues to make progress. And my philosophy and my theme, my mantra, if you will, has been forward is forward, no matter the speed. And so I take that into my consulting and my coaching parents so that they understand that forget the milestones, the checklist, the standardized tests. As long as your child is taking baby steps forward, we're moving in the right direction. So no, I love that you asked that question, because I did not start talking about him. It was very cathartic for me when I did, because the support was overwhelming.
Oh, I have goosebumps, and you'll have to forgive me. I think it's still like hormones after having a baby, but I think now being a parent and just like, you want the best for them, and you get so many mixed messages of like what is right and like what you should be doing with them and what's normal. Like I actually saw a post that said this, and this is not normal. And my daughter happened to do that.
Uh-huh.
And this was from another speech language pathologist. And I was like, is this like the type of messaging that we're sending out? Is this the type of messaging that I might have sent out as a professional prior to having a child? So
Mhm.
I just love that you share all of these like neurodiversity affirming, messages
Yeah.
that just really like show that, forward is forward, and like he is perfect just the way that he is. And
Absolutely. Absolutely. And one of the things we'll talk about today is just because it doesn't mean that when we talk about autism acceptance, it doesn't mean that autistic children don't need services or supports. I mean, that's not what we're saying, right? I mean,
right.
he is who he is. And my son has a disability and my son needs extra supports. But my goal in life is not to change him. It is not to try to make him act like his neurotypical sisters, which is really what I think as speech language pathologists, at least when I went to grad school back in the 1990s, that's kind of what we were doing. We were creating social skills programs and trying to make autistic children not autistic anymore, right? We were trying to cure them, if you will. So I'm very excited to talk today about neurodiversity affirming practice with you.
Yeah, so am I. All right. So before we dive into it, we got to share our disclosures for
Oh,
ASHA
yes.
purposes really quick. So I'll let you go first and then I'll share mine.
Yes. As far as my financial disclosure, I am author of the Learning to Learn program, which is an early intervention coaching program for supporting families who have autistic children. And so I will be referencing that a little bit today. I am also author of a ton of different handouts, but my Understanding Autism handouts is my newest release. And these are neurodiversity affirming parent handouts. So I will be drawing some of my information from the resources and the references in those products. And I do obviously receive benefit financially from all products that are sold on my website. And I do benefit financially from Speechy Side Up for agreeing to do this podcast today. My non-financial disclosure, I'm a parent of an autistic child. So I do share personal experiences in all of my presentations and interviews.
And we're grateful for that. Really briefly, I have ownership interest in Speechy Side Up LLC and Tassel Learning LLC, and I receive royalties from the Lou Knows What to Do book series. And I'm also a member of ASHA Special Interest Group 12. So our hope by the end of this pod course is that you will be able to define neurodiversity affirming practices, describe 2 types of therapy approaches, describe 3 types of functional goals, and identify 2 reasons to consider AAC. So let's dive in. What is considered neurodiversity affirming practice?
Great. So I'm going to go ahead and talk a lot because that's what I do. And there will be a handout. Is that right, Vanita? That will have this information on it so that you don't feel like you have to write like a crazy person, or if you're driving in your car and can't take notes. But when we talk about neurodiversity affirming practices, or even if you just want to say neurodiversity informed, right? Because I really am becoming more and more informed. And I'm the first one to say, I am not claiming to know everything about this, right? I don't even say that I'm an expert in autism. I say I specialize in working with autistic children, but the true experts in autism are autistic individuals. And so what I've really learned, and the pandemic has given me a lot of time to listen. And so just know that when we talk about neurodiversity affirming practices, the very first thing we're going to do is listen to actually autistic voices. It's so important that we listen to their voices. And so autistic adults are the experts on autism. And so I have done a whole lot of listening and learning. The 570 days that I was basically unemployed because when the pandemic hit, I stopped all of my traveling around the country. And so I went 570 days without doing an in-person seminar. And for somebody who used to travel 45 weeks a year, it has been quite a change. So I've done a whole lot of listening. So the first thing we're going to do is listen to actually autistic voices and listen to the way they say that it is okay of being human the autistic way. That right, what we're going to do is start really checking our own biases as neurotypical individuals. We're going to check our biases. And I think one important question to ask yourself is this: do you view autism as a tragedy? I've heard some people say, oh, autism is a superpower. Okay, so do you view autism as a tragedy? Do you view it as a superpower? Do you view autism as good? Do you view autism as bad? Because the way I would answer all of those is autism is the end. It is. It is a different neurotype. It is a different way of being human. It is neither a tragedy, nor is it a superpower. It is neither good nor bad. Autism just simply is. So for pediatric speech language pathologists, one of the issues I think we run into is something called norms, right? We do all our standardized tests, right? And oh, what are the norms? He's 2 standard deviations below the norm. So this word norm, I have a real issue with, and the neurodiversity, lens, if you will, is not. We're not going to talk about norms anymore. Okay, I understand we have to do standardized testing to determine eligibility for services. The end. That is the only reason we're using standardized testing. We're not writing goals from it. We're not drawing any conclusions from it. It is simply to determine eligibility. Does that make sense? So once the child has been deemed eligible for services, what we're going to do is recognize that despite what the standardized test says, that there is not one acceptable way of being human, and that's the normal way or the neurotypical way. Because what we as neurotypical people have assumed our entire lifetime, and this plays into the ableism, but what we have assumed our entire lifetime is that the neurotypical way is the only acceptable way of being human. And so if you don't act like neurotypical people, then there's something wrong with you and we need to fix you, right? We need to change the way that you act. So neurodiversity affirming practices, we're not looking to change the individual. We're not trying to make them act a certain way. Okay, so we're going to check our own biases. We're going to listen to actually autistic voices. We're going to use neurodiversity affirming language. Okay, so for example, saying autistic child as opposed to child with autism. I know we were all taught in grad school to use child first, right? He's a child first and then he has autism. Well, the majority of autistic adults actually prefer identity first language, autistic person, autistic child. And the reason is because they say this is our neurotype. No matter how much therapy you provide, you can't ever make us not autistic. That being autistic defines our humanness. It is the way that we perceive the world. When I describe what autism is in my own words, instead of using the DSM-5 diagnostic criteria, I always explain that autism is a different way of experiencing the world. It's a different way of taking in and processing sensory information, right? It is simply a different way of being human. And so thankful to Dr. Barry Prezant for writing this book, Uniquely Human, because that's where that phrase comes from. It's a different way of being human, right? Autism isn't an illness. It's not a disease. It doesn't need to be cured. So one of the ways we use neurodiversity affirming language is we don't say things like red flags for autism, symptoms of autism, because red flags indicates there's something alarmingly wrong with your poor child, right? Oh, I think he has red flags for autism. And no wonder the parent thinks it's a tragedy. So instead of using those frightening, alarming, scary terms, symptoms indicates there's a disease. Well, if there's a disease, we need a cure for it, right? We need medicine or we need some kind of treatment. So, I mean, I had symptoms of breast cancer. I had a tumor. So of course I want to fix that because it could kill me, right? But you don't have symptoms of autism. You don't have red flags of autism. You have traits or characteristics of autism, right? That just help us to understand your neurotype, understand how you think, how you interact with others, how you perceive the world. So our neurodiversity affirming language is going to really affect how we write goals as well. We're going to be using a strengths-based approach. See, what we were trained to do, because most of us were trained under what we'd call the medical model, the rehabilitation model of doing speech therapy, if you will, right? So there's a deficit, so we need to go in and fix that. And so that medical model tends to use negative language, negative worded language. What we're going to do is make sure that we're writing goals that are relevant and meaningful, that are based on the autistic child's strengths, that are based on their interests, that are based on their unique talents. And we're going to make sure they're relevant and meaningful. So in almost all of my trainings, I introduce the acronym PIE. PIE. So this is going to be an important thing because the way you know if the goals that you're writing are functional is they should focus on improving one or more aspect of PIE. And what does PIE stand for? Participation, independence, and engagement. And as long as we are focusing on increasing either the child's participation, independence, and or engagement in their daily routines and activities, then we're writing functional goals. So that is a huge component. And we are going to look at their special interests. We are not going to call them obsessions. We are going to call them special interests because that's what they are. And we're going to use those special interests to design our programming, our autism programming. We're going to make sure that we don't work on social skills that encourage the autistic individual to mask. Masking is camouflaging one's autistic traits. And what autistic adults have explained to us very clearly is that masking leads to huge issues and later on in life. And they start to wonder, what's wrong with me? Why am I not normal? That, they're constantly feeling like they're not good enough. So instead of teaching autistic children to socialize like their neurotypical peers, what we're going to do instead is we're going to focus on autism acceptance, and we're going to teach neurotypical people how to interact with autistic children. Do you see how that's totally different than what we were trained to do? So we're really going to make sure we're not teaching anything that has to do with masking, like forcing eye contact or forcing them to stay on topic for 5 minutes or, whatever. We have to understand that the autistic way of being human is not going to mirror the neurotypical way of being human. I think another important part of neurodiversity affirming practice is to focus on individual needs. I'm sure you've heard the saying, once you've met one autistic person, you've met exactly one autistic person. So we don't want to lump all autistic children or all autistic clients or all autistic people into one category. And then all of a sudden have somebody create a goal bank that we can pull goals from, because if you're drawing from a goal bank, you are not providing individualized, goals and individualized services. So we are going to be very careful about that. And the last thing I will say about neurodiversity affirming practices is we must always presume competence. Okay, regardless of what standardized testing tells us, we are going to choose to presume competent. So we're not going to say things like, oh, well, he can't use that AAC device because he's autistic, or, because he doesn't have good visual attention. We're going to not talk about autistic children as if they're not in the room. We're not going to, talk about their behaviors and, when they're sitting right there. So we're going to make sure that we presume competence. I did a social media post just this week that had 2 big eyes on the front, and it was all about what you see is what you will find, basically meaning, or what you look for is what you will find, meaning if you look for bad behavior, what are you going to see? You're going to see bad behavior. If you look for positive behavior, what are you going to see? Oh, you're going to see the positive, right? If you look for the child's weaknesses, you're going to find those. If you look for their strengths, you're going to find those. So you get what you look for. So let's make sure that we go into this with a positive attitude, and that we are looking for strengths, that we are looking for special interests, that we are looking to make a connection with the autistic child. That was a lot of words I just said.
Oh, just listening to you, you're so passionate and you're so knowledgeable on this topic, and you said so many good points. I was writing furiously, but I wanted to just recap on a couple of things. I love what you said about standardized testing, because obviously that is something that is going to come up, but I love that you said that standardized testing is for determining eligibility, and that is it. I think that is such an important distinction to make. And then I love the PI acronym, and I know we're going to get into goal writing later on. So I think that is really helpful for assessing our current goals. I wanted to ask you, and this is probably individualized, right? Like, what is our long-term goals or vision for our neurodiverse clients? Is there an easy answer for that or no?
Well, one of the answers that I almost always give is independence. Everything we are working for is independence. So what we should always do is be writing goals that with faded prompts, right? With faded visual cues, whatever it is that we want the child or the student to become independent with whatever, the goal is. So I always say what we're striving for with our neurodivergent students is independence. I can't think, something my husband and I have said for years is we're not raising a child, we're raising an adult. I mean, and I think it's very important to recognize that we're always shooting for. So for me, pie is the answer to all of it. We always want increased participation. My son has always avoided participating in like family meals. He wanted to eat alone, right? He always avoided participating in like sports with other kids. He preferred to play alone. Does this make sense? So participation is how you get varied experiences, and varied experiences are how you develop executive function skills. And so for me, participation is huge. Independence is the second part of I, right? Well, obviously that's what we're working for. And then engagement. I mean, there's a saying, people will say, oh, autistic people prefer to be alone. Oh, no. We can't say that. That what we need to understand is that autistic people want to have relationships with other people, but their sensory differences often interfere with their ability to handle it. They get so dysregulated that they often can't handle it. And so we never want to suggest that autistic people don't want to be around other people. What we want to do is focus on self-regulation so that they can be around other people. So the older my son gets, the more regulated his nervous system gets, the more engagement my son has with other people. And I post about it frequently on social media, some of the things that he does that just blow my mind. So
That's awesome. You said you spent a lot of time listening to autistic voices. Do you mind sharing some here in case anybody's interested in following them?
Yeah, the best thing to do on Instagram, for example, is to follow hashtag actually autistic, because the only people who can use hashtag actually autistic are actually autistic people. So like as a neurotypical person, I can't make a post and then put hashtag actually autistic. The autistic adults will call you out on that. I tried it once because I didn't know the rules, right? So you learn the rules. So if you just follow that hashtag on Instagram, if you go to autistic cats, so instead of Aristocats, it's like autistic cats. That's who I started following, and they have so many followers now. It's insane. Other than that, I don't know that I have any. I mean, there's so many. I couldn't even like name them all for you. But if you just follow hashtag actually autistic, you will get to. I mean, you can just pick and choose who you want to follow, because there are so many amazing voices out there to listen to.
Perfect. Thanks for sharing that.
Mm-hmm.
And then the last thing I wanted to ask, and maybe we'll get into this. I know that you work in early intervention. I work the whole lifespan right now, but I have kids in early intervention. And Andy from Miss Speechy P posted a funny reel about this, but not funny in the same sense. But a lot of therapists are afraid to, like, if they're suspecting that it's autism, they're afraid to say something. And I think that comes from sometimes working in the schools where like some school systems don't let you do that, or stepping on other people's toes. What is your perspective on that, and how do therapists approach that?
Yeah, for years, I've always said, oh my gosh, I have to say the A word today. Like, you dread going to an early intervention home visit where you're like, I got to bring it up. I got to say the A word. And so that's how we've always thought of it. The A word, it's something taboo. Nobody, because it was a tragedy, right? Mm-hmm. So what is most important now is that before we bring up autism, that we need to be bringing up some of the traits of autism that the child presents with. So we can say things like, oh my gosh, I noticed that he really seems to be able to self-calm by spinning and flapping, or, by lining up his toy, whatever it is, whatever you're noticing. Or it seems like he, when he gets excited, he squeals in that really high, high-pitched voice. And so then as we start pointing those things out, we start talking about how we too have ways of self-regulating. It seems like he calms himself down by lining up his toys, or, whatever it is. I know when I get kind of overwhelmed, I chew gum, or I, clean out my closets. Like that's what I literally do. Like organizing things for me is very therapeutic. It's very like when my life is in chaos, my closets need to be cleaned, because there's something about that. So I explain. So what we start doing is I start having conversations with parents about what do you do, to calm yourself, so that we're all talking about sensory, and we're talking about, different ways of communicating. And I notice he doesn't, make eye contact with you, but I do notice that he tries to get your attention in other ways, so we'll point out that autistic joint attention, but we're not going to use that word right away. We're going to start pointing out these developmental differences. And then when we have a really good relationship with the parent, we're going to say, over the past few weeks, I've been pointing out some of the developmental differences. I never say differences is the word I use. I don't use red flags. I just say I've been noticing and talking to you about and documenting some of the developmental differences that, Ashley presents with, or that Connor or Carlos, whoever it is, has. And I just want you to know that some of those, when you look at them all together, they are consistent with a child on the autism spectrum. I mean, I'm not saying he is, but I just want you to know that that's kind of where I'm leading. And I know autism is usually talked about in a negative way, but it's so important to really understand that autism is just a label that helps us to recognize that the child learns differently than other kids, that the child is going to develop language differently from other kids, that the child is going to process sensory information from their world in different ways. So the label doesn't need to be scary. It's just something that is. And if it's something you want to talk more about, I'm here for it. It's something along those lines where it's just more after several visits, though. I mean, I'm very, I guess, explicit in my coaching of parents of the differences, the developmental differences that I'm seeing in the child, right? It's not just out of the blue one day, I wonder if you want to take him for a developmental evaluation because he might, be on the autism spectrum. And I mean that, so make sure you work up to it. Don't just throw it out there. And I think it's a good thing to ask, have you ever heard of autism? Do you know anyone who has an autistic child? You know what I mean? Like, let's start the conversation. And you're going to have parents who shut you down. Okay. And that's why you have to have that relationship first, right? So that you don't just throw this on them and then they're mad at you and then they start canceling their visits and they want nothing to do with you anymore. So it is a real art. My pediatrician also has an autistic son. So when my son was 2 and I was going to my pediatrician and he gave him a provisional diagnosis, okay, of autism at age 2. And so a couple of years later, after my son got his firm diagnosis from a developmental clinic, I went back to my pediatrician and I asked him, I said, as an early intervention provider, do you think I should talk to parents about autism when I think that's what it is? Because remember, this is back when autism was considered a tragedy. So I asked him, should I? And he looked at me and he said, Carrie, it is your professional obligation to tell parents what you think is going on, why their child is not developing, as expected. He said, it doesn't matter if it upsets them. He said, do you think when a doctor tells a patient they have cancer, that they're like having the best, that that's their favorite thing to do, or when they have, need a blood transfusion? He's like, whatever it is, your job is to tell the parents what you think is going on. He said, and don't present it as something tragic, right? Just tell them this is what I'm seeing and I'm here, to help navigate this. We're on this journey together. So it was really helpful for me back then when autism was considered a tragedy for him to say, yeah, you should say something. It's your professional duty. It's your professional obligation. And so that has always stuck with me.
Yeah, well, so many of the things that you just said are going to stick with me. And I'm sure the people that are listening, thank you for that. And I think it's so important for SLPs to hear this because we're often one of the first professionals that work with them, right? And it has been, interesting for me to navigate, but you gave me some really good ideas because it's still happening where parents are getting like notified out of the blue that the child is getting an evaluation. And, I'm kind of in this process where I'm trying to develop rapport, but I also, on the other hand, don't really know how to introduce it in the best way. But what you just said is so helpful. So thank you for that. I appreciate it.
And one thing, write this acronym down, the TASI, TASI. The TASI is the Toddler Autism Symptom Inventory. I hate that they use the word symptom, but it is brand new. It just came out. It's from the MCHAP people, the modified checklist of autism in toddlers. But the TASI is a newer, much more thorough. It is just a screening tool. I've used it several times. It is free online. Make sure when you download the PDFs, download all 3 sections because you need the questions for the parents, you need the scoring guide, and you need the manual of how to interpret it. So you do need all 3. So make sure you do download all 3 PDFs. But the TASI is phenomenal. And what I love is at the end, when you're done scoring it, and don't score it in front of the parents. I mean, it takes time. You really need to spend thoughtful time scoring it. But a score of greater than 7 indicates an increased likelihood of autism. And I think it's 7. 7, but I don't have it right in front of me. And a score of less than that indicates a decreased likelihood. So I really like the wording there. We're not saying they are or not autistic, but it is just so much more thorough than the MChat. So I highly recommend that you have that handy. And I wish the pediatricians would start using that instead of the MChat at the 18-month visit, when they're supposed to be doing that. So very helpful screening tool.
Thank you. That's awesome. We'll try to include that in the resources section.
Yes, I'm going to write that down so I don't forget.
Awesome. Is there anything else that you wanted to touch on before we move on?
No, let's move on.
Let's do it. So let's talk about the different therapy approaches that are recommended when working with neurodiverse clients.
Okay. And the first thing I want to do is clarify that it would be neurodivergent clients. So this is part of learning the language. Neurodiversity is, and I have this great handout in my understanding autism handouts, because this was so hard for me. So we have the terms neurodiversity, and this is just a big, broad understanding that there are expected variations in the human genome, that the world, human beings are neurodiverse. Okay. So neurodivergent is referring to a specific, so a person is neurodivergent, a person isn't neurodiverse. Okay. Society is neurodiverse. Okay. Our world is neurodiverse. But neurodivergent refers to a person who has some type of variation to their neurology. So a neurodivergent person might have a diagnosis of autism, ADHD, dyslexia, apraxia, Down syndrome, Fragile X, right? Those are people who are neurodivergent. Okay. So the neurodiversity movement, which is what I've been learning an awful lot about and really trying to, align my practices and my professional development courses with this neurodiversity movement, has helped me to understand that the language does matter. So we are neurotypical. If you don't have a diagnosis, then you're not neurodivergent, you're neurotypical. The other word that I'll throw out there, it's allistic. ALLISTIC. Allistic just means not autistic. So a person could be neurodivergent and allistic. So if you're neurodivergent and allistic, it means maybe you have ADHD, but you're not autistic. Does that make, it's a lot of language.
Yes.
I'll try to include that in the notes. But so when we're working with a neurodivergent, client, whether it's a child, whatever, neurodivergent student, neurodivergent child, I really focus on, you have two choices. What are our two therapy approaches? Okay. The traditional therapy approach is what we'd call a behaviorist approach, right? We're going to focus on compliance. We are going to focus on establishing behaviors that we feel are socially acceptable. And I am actually consulting with a school district right now, because they have an autistic student who has significant challenging behaviors. We're talking about, scratching, hitting, fecal smearing. And he's in 6th grade, right? So these are really significant behaviors to be happening in a middle school. But when I went and did my observation, the thing that I realized is they're using a behaviorist approach. So everything that they are doing is compliance based. They don't care what he does, but he has to do what they say when they say it. They use candy as reinforcers, right? So all they're doing is dangling the carrot, as Alfie Kohn says, dangle the carrot to try to get the child to comply. So when you use a behaviorist approach, these are going to be terms that are going to be in your documentation, and your philosophy is going to be based on compliance. There's going to be a lot of first then. First, do your work, then you can have your special interest. Oh, you love unicorns? Guess what? I'm going to withhold every unicorn that you love. I'm going to snatch them away from you, and I'm going to make you work for them. You're going to earn, those unicorns, or those, whatever it is, whatever the kid, his special or her special interest is, I'm going to make you work for it. Another thing that we'll talk a lot about in a behaviorist approach is reinforcers. It's going to be rewards driven, and they're tangible reinforcers usually. Like, right, you're actually working for something. It may not be your special interest, but I'm going to give you an M&M when you're done, right? Or I'm going to give you 5 minutes on the iPad after you finish this irrelevant activity that we're going to engage in. There's a focus on fixing or changing the client's behavior to mirror the behaviors of neurotypical students, right? So I'm trying to just make you act in a more socially acceptable way. I want you to act like that allistic child over there. So those are kind of the components of a behaviorist approach. If you can't tell, I'm not a fan. Okay. My son has never had any ABA type therapy at all. In
Wow.
fact, my son has had very little therapy altogether. And I know this is going to sound strange coming from a pediatric speech language pathologist. And I did a post on this probably a year ago, and the feedback I got was crazy. But my son has had very little therapy in his life. I'm actually not a huge fan of therapy. And I know that sounds crazy, but what I am a huge fan of is parent coaching. I'm a very huge fan of teaching meaningful skills in meaningful ways with the meaningful people in the child's life. And that's why early intervention works for me. If I were in the schools, which I've never worked in the schools, but I would be all about coaching the teacher and the paraprofessional and making sure that they are following through. My big issue is we can therapize kids, and we're pretty notorious for doing that, where they act and perform a certain way in our therapy room, right, or in our session, but then it's not generalized or carried over into their ADLs, their activities of daily living. We don't see it anywhere else. So I'm just not a huge proponent. My son has had very little therapy outside of school, and whatever the school provides, I'm grateful for it. It's fine, but I'm not one of those parents who's going to argue over the IEP. I mean, whatever you do is great, but I actually prefer my son stay in the classroom as much as possible. I prefer that he, really learn in that environment. And we do a ton here at home to try to build his executive function skills. And I could talk about that all day long, but so that's the behaviorist approach. Okay. The approach that I coach everybody on. I include it in all of my trainings, and I'm going to go spend a week with this school district in the classroom. I'm going to be in the classroom for 4 days, modeling this and coaching the teacher and the paraprofessionals on this. This is a relationship-based learning approach. So when we focus on the relationship-based approach, what we are going to practice is acceptance. And this is where you've got to check your biases, right? Because if you think that autism is a tragedy, that autism is bad, you're going to have a really tough time trying to build a relationship with this child. No matter what the behavior issues are, no matter how severe they are, you have to make sure that you are co-regulating. And to me, this is huge because, again, if you look for bad behavior, that's what you're going to see. And that's all you're going to see. So you'll have to be able to start fresh the next day and come in and be excited to see the child, right? You have to be excited to work with the child. Yes, this child presents with some challenges, but we really have to focus on accepting the child for who they are and recognize that those behaviors, those are communicative, right? That child is trying to tell you something. And so we need to make sure that we are focusing on respectful interactions. And one of the things that I coach people on whether I'm in a classroom or in a professional development course is I like this idea of symmetrical interactions, okay, where there's mutual respect. This is what we tend to see, especially in children with challenging behavior, is there's asymmetrical interaction. So you've got this adult up here hovering, letting the child know, I'm in charge, I'm the teacher, I'm the therapist, I'm the parent, and I am in a top-down fashion. I'm going to tell you what to do, and I'm going to withhold everything that you love until you do what I tell you to do. Well, when you create this asymmetrical interaction, I can tell you right now, the kid doesn't respect you. The kid probably doesn't even like you. So now you're going to ask him to do hard things, and you think he's going to do hard things when you don't even like him, when you don't even respect him, when you taunt him, when you put your hands on him. I don't know that it comes up specifically here, but one of the things to make sure, and maybe when we get to goals, we can kind of touch on it if we have time, but we should not be doing any type of hand over hand assistance. I mean, that is a violation of body autonomy. And so the more you put your hands on the child to get compliance, don't you dare be surprised when that child hits you, slaps you, spits in your face, or puts his hand down his pants and wipes poop on the wall. Okay. Because I guarantee you, if I came up to you and said, hey, Vanita, can you go do the dishes for me? You'd be like, oh, no, I don't want to do the dishes right now. Like, I don't have time. And I'm like, Vanita, go do the dishes. And you're like, I'm not going to do it. So I say it again, Vanita, I want you to go do the dishes. And let's say you just flat out ignore me. We're adults, right? And you just flat out ignore me. What if I walked over to you, put your laptop down or your iPad or your phone or whatever it is you're doing, made you stand up, grabbed your arms, made you stand up, dragged you to the sink, and then hand over hand, put your hand in the sink, wash the dishes, would you and I be getting along very well? Would you
No.
and I like have a really great relationship? Or would we be like, wait a minute? I mean, does that seem pretty asymmetrical to you? So just
Yeah.
because these human beings are children does not give us the right to disrespect them and to put our hands on them. So when we start using a neurodiversity affirming approach, we come in as equals, right? I just want to, my favorite saying, and I say it all the time on social media, focus on connection over instruction. Forget trying to teach him something. Okay. First, establish that connection. So how are we going to do that? We're going to be calm. We're going to be interesting. We're going to be interested, even in their special interests. If you followed me at all on social media, you know, my son, his special interest is wild animals. And so what have I done? I have turned that into an interactive activity for he and I, where he tells me all the different things about a specific wild animal. And then I create a post on Canva, and then he and I share it together. We talk about it. And I mean, people have learned more about wild animals from Aaron's post. But what could I say as his parent? Buddy, you need to stop obsessing over wild animals. You've been obsessed with them for like 10 years. Can you find a new hobby? I mean, sure, I could do that, but why would I? Right? So what I'm going to do is honor and respect that he has a special interest, and that it's likely going to determine his profession someday. Right? Because we all are going to gravitate towards things that are of interest to us. The other thing, the other component of a relationship-based approach is we are going to respect and acknowledge the child's sensory preferences. Because I'm telling you right now, sensory trumps everything. And if the child is not regulated, is not in a ready state for learning, you can kiss your lesson plan goodbye. I mean, I don't give a crap what your goals are or what your intentions are for teaching or for doing therapy that day. But if the child isn't in a ready state for learning, if the child isn't regulated, you're wasting your time. So we're going to use co-regulation to make sure that the child and I feed off of each other in a positive way. We're going to respect their sensory needs and preferences, and we're going to focus on connection over instruction and really build that relationship first.
I love that. And I love the examples that you gave too of like going to wash the dishes and using hand over hand, because it doesn't always end up that way with hand over hand, right? But sometimes it can, and it can like get aggressive. And when you put it in that perspective, you can absolutely see why that type of interaction can end up that way. So I appreciate you sharing that. I love what you said about sensory trumping everything, and just all of the amazing points you made about the relationship-based therapy approach and accepting the child for who they are. So thank you for that.
You bet. You bet.
Awesome. So let's talk about goal writing that are neurodiversity affirming. I'm so grateful that and thank you for your grace in explaining this terminology to me, and just, when you know better, you do better. So you'll have to let me know if there's any other terms.
And I don't like calling people out, but people called me out on social media when I was using it wrong. I was like, oh, I have a neurodiverse son. And they're like, no, you actually don't. You have a neurodivergent son. I'm like, oh, I do. So for me, this has been a huge, learning curve. And so that's why I'm like, in my handouts, I'm like, I just want people to like have the information, because not everybody was unemployed for 570 days. Not everybody was able to just sit on social media and learn and listen and, get yelled at and then refine your practice. And so like, I feel like I've done some of the hard work, for SLPs and for, other providers as well. But I feel like there's a few of us, like you mentioned, Mrs. Speech EP and Meaningful Speech and Jesse Ginsburg. There are at least, a handful of us in the SLP world who are like, we're trying really hard, to focus on neurodiversity affirming practices. And the thing is I don't have a full caseload of kids like most SLPs do. So I have the time. And so, that's part of what I'm doing, is trying to support, other SLPs and ultimately support our autistic clients along the way.
Yeah, it's the most important piece.
Absolutely.
Awesome. All right. So let's talk about goal writing. I'm excited to hear about it.
Yeah. And I know everybody, goal writing is one of those things where it's like, oh, just tell me the goals to write. Well, that's not what this is. Like, I mean, they can't be individualized, so I always encourage you to go back to PI. Okay. What is the focus? So let's say as SLPs, we're like, oh, well, he needs a way to communicate, right? Where, he doesn't communicate very effectively. Okay. So communicate when? This is something I'm always asking the families, when I'm in early intervention, they'll say, well, I just want him to talk. And I say, well, communication trumps talking. We're not going to talk about talking. Okay. We're going to talk about communicating, and we're going to talk about all the different ways there are to communicate. How does your child currently communicate? Well, they don't talk. No, I know they don't talk. I want to know how they communicate, right? So we have to have that huge discussion and really open parents' eyes and sometimes, educators' eyes that communication is happening. It just may not be talking, right? Which is, remember at the beginning when we first started talking and you said SLPs are often the first ones like on the case, the first ones to notice. Well, the reason is because the kid doesn't talk usually. So who gets called? Oh, the SLP. And what do parents say? The only thing I care about is I want him to talk. Well, sorry, that's not how this works. Okay. So we have to let them know that there are foundation skills, if you will, that we are going to be focusing on, and that talking is one way of, expressing yourself, but that we're going to focus on all the different ways. We're going to give this child unrestricted access to a multitude of ways to communicate. So, we want our goals to really be strengths based. So they're not going to be focused on trying to make the child act neurotypical. We're not going to write goals that mirror the behavior or the actions of a neurotypical child. So we're going to think about and it was so funny when I was doing this, when I spent a few days in this classroom with this sixth grader who has some significant challenging behaviors, I asked the staff, what are his strengths? So we were sitting around, I observed for a whole day, saw behavior it was intense. So when we sat down for a meeting afterwards, after all the kids had gone home, I said, what are his strengths? And do you know, they couldn't come up with one thing. I had identified 4 strengths. So when I identified the strengths, some of the staff were rolling their eyes, because they were like, they just can't see the strengths. Okay. So, one of this kid's strengths was that he actually wants to be around people. He's so social, but he's always got his hands on people and he's, but he clearly has an interest in being around people. So anyways, I identified 4 strengths and they couldn't identify one. So you first, before you ever write your goals, you're going to identify the student's strengths and you're going to build off of those. You're not going to do what we were trained in grad school, which is look at what they can't do on a standardized test. So now you're deficit driven, right? If you're looking at what they can't do, you're using a deficit driven model. So then you're going to try to teach them to do those things. So instead, what we're going to do is focus always on strengths first. I always encourage when you write goals to think about the child's perspective or the client's perspective. How would they, how would you feel if you were in their shoes? So literally like the example I gave about hand over hand assistance, right? Or whatever it is, you need to think about what if, you wrote a goal that has to do with not talking about wild animals. Like that was, my his thing was Angry Birds when he was in elementary school, and he loved Angry Birds and he wanted to tell you all about Angry Birds. And when I sat in one of my son's IEP meetings, the OT said, we're just trying to get him to stop talking about Angry Birds. He's obsessing over it. And so that's our goal, is to get him to talk about things other than Angry Birds. So to see how that's a deficit driven, that's going, we're kind of trying to change him. And I said, well, but if you use Angry Birds and build a connection with him, one of the goals that he wasn't able to meet forever was look at a picture card and recreate a block, like stack blocks according to a 2D picture. Like, I don't even know.
Oh my gosh, that's like Angry Birds. Like that would
serious. I know. So I was like, you guys, I know you say he can't do this. He can do it at home because he has all these Angry Birds cards and then he has all these bricks, from the Angry Bird, and he can absolutely replicate it. And the OT was like, well, he doesn't do it here, so we have to keep working on it. And I'm like, if you just let me send in 2 Angry Birds and 2 pigs, his little plastic ones, and just tell him we're building Angry Bird towers, he'll meet the goal right up front. And they hem and they hawed because they're like, but we're trying to get him to stop talking about it. So I finally convinced him, and guess who met his goal? The very first time they did it. So this is why, and don't ever forget, and this is something I get on a soapbox about this, parents are the expert on their child. And I understand that children act differently at school than they do at home. But when a parent says, this is going to work, we at least have to listen. We can't write them off as, those crazy parents. I will always be the expert on my son. There is no way any teacher, any therapist will ever know more about my son than I will. So I appreciate it when professionals listen to me as the parent. So strengths-based, you're going to consider the client's perspective. Functional goals is what we should be writing. So in order for them to be functional, what that means is they should be relevant and meaningful, and they should have nothing to do with that standardized test that you just gave. So like one of Aaron's very first IEP goals when he was 3, he went to early childhood, and we're sitting at his first IEP meeting. And one of the goals the SLP wrote was Aaron will identify pronouns and pictures with 80% accuracy. My son didn't even talk at age 3. Like, he had no real good way of communicating with others. And I'm like, and you're going to work on identifying pronouns and pictures. Okay. And I know exactly where that came from, the PLS, because there used to be in the PLS-4 a picture of stairs. And on one set of stairs, there was a roller skate. On another set of stairs, there was a girl. And on another set of stairs, there were like 3 or 4 kids. And the examiner says, show me, she is on the stairs. I know exactly where they got this goal. So when I see that on an IEP, I'm like, right? That is not a functional goal. That is not a skill that he needs to be able to participate in his daily routine. So we want to make sure that they are functional. So we're not writing goals based on standardized tests, and we're not writing goals based on neurotypical behavior, right? We're not trying to get them to act like a neurotypical student. Goals should always focus on increasing at least one aspect of PI: participation, independence, or engagement. Because here's the deal, guys. Think about this. As we really intentionally focus on increasing PI during the child's daily routines, activities, whatever it is, as PI increases, degree of disability decreases. Mull on that for a minute. As participation, independence, and engagement increase, degree of disability decreases. And ultimately, that is our goal as therapists, is it not? I mean, it should be, right? Is to decrease the degree, if you will, of disability. How much more can the child participate? How much more independent is the child? And how much more is the child engaging in that? So we're talking now about social emotional development, right? Being able to learn how to make and keep friends, interact with others. Another component to think about for SLPs when goal writing is we have to determine whether, especially in minimally verbal kids and our younger kids, is this a Gestalt language processor or is this an analytic language processor? Because the way most of us were trained to do speech language therapy when we were in grad school was to support analytic language learners. And those are the kids who babble. Then they say one word, mama, and then they, so at first they go, mama, 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 and then they say mama, and then they say mama go, and then they say mama go bye-bye, and then they say, I love you, mama, let's go bye-bye, and they talk in sentences, right? That's how an analytic language processor develops language. But so many of our autistic children are not analytic language learners. They are Gestalt language processors. And so they use scripts, if you will. They use echolalia, delayed and immediate echolalia. And so my son had a script. It was the only thing he said at I'd say about age 2 to maybe close to age 4. The only thing he said is, are you okay? Are you okay? And everybody always said, oh, he's so sweet. He wants to know if I'm okay. But he said it like 400 times a day. At the time, I didn't know what a Gestalt language processor was. So now I understand that was his way of just simply, I'm sure I asked him, picked him up from daycare one day, and he was probably crying. And I said, are you okay? And then I probably gave him a hug and loved on him. And he's like, oh, that's how I initiate an interaction with someone, is I say, are you okay? Are you okay? Are you okay? So see, he was a Gestalt language learner. And as an SLP, I thought, why can't I help my own son? Because I was trying to help him learn language using an analytic language processing style. So we have to make sure that we understand how to support Gestalt language learners. That's what I have on writing goals. So again, I know you were super excited and you're like, she's going to give us all the answers. And I'm like, goal writing isn't that simple, unfortunately.
Yeah, no. It reminds me of a reel that it's like, it's not that simple. But I actually just spoke with Alex from Meaningful Speech yesterday, and she shared the quote that 75 to 80% of autistic children are also Gestalt language processors. So it's a really significant, percentage. But I wanted to ask you, because this was a conversation that we kept talking about, kind of interweaving yesterday, since you do early intervention, she was saying that you can identify our Gestalt language processors, early on, but we tend to not notice it until we see that jargon-y like type of script where it's unintelligible, but it sounds like jargon. But what about even earlier than that? Like, around the year mark or around the 18-month mark, do you happen to see what a Gestalt language processor, like what those early markers might be before we get to that jargon phase?
That's where I think they may be, because like my son didn't babble. I mean, my son was really very quiet as a baby. Now, my son also has apraxia. So my son, it's very difficult because, and his apraxia is not something that really rears its ugly head anymore. When he does try to say a really new, long, complex word, he struggles. But for the most part, we resolved the majority of the apraxia issues. So with the very young ones, I think you're going to see, it's so hard to know, but I think what you'll hear is their first word won't be a first word. It'll be a first phrase. I really still think with the very young kids, the toddlers, that's what you see. So they don't say dada, they say, I love you, daddy. And you're like, whoa, that was amazing. Just like how my son, his first word was basically, are you okay? Are you okay? And you're like, wow. I mean, the inflection was perfect, but like, where's mama? And my son didn't say mama and dada. I don't even know. I mean, I'm gonna say he was probably 4 years old before I ever heard mom, and it was never mama. It was just mom. So I don't know if I have anything great to add to what Alex probably talked about, but I just think you're not going to see. So we always are tracking first words. I think what you need to listen for in the really young kids and the toddlers is they're going to be drawn to music. And I think what you're going to hear, my son was so drawn to music, and they repeat back in their kind of jargony ways. It's the intonational pattern. So, you're going to hear a lot of that. Lori Berkner was my son's favorite. I mean, that was back when you had CDs in your car and we had to listen to buzz, 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 buzz. I mean, my daughters and my husband and I, we thought we were going to lose our mind because every time we got in the car, Aaron would start going buzz, 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 buzz. And he had the perfect, but and he would sing, but never the words. It was just more the, kind of intonational patterns.
You're so right, Carrie. And that's what Alex said. I mean, I was giving her an example of a specific client that I had in mind and just said how much this client like really enjoys nursery rhymes. Like we do the whole session in nursery rhymes because that's what they're super enjoy. What she's like, that's what you have to do. If that's what they're drawn to, and you suspect that they might be a Gestalt language processor, then that's probably how they're going to learn language.
So there's a lot of music and a lot of rhymes. And so you're going to pick books that are more sing-songy, like if you're trying to introduce books, and like, that's why I love doing like chicka, chicka, boom, boom. That was always my son's favorite because we go chicka, chicka, boom, boom. And you could add an action to it and really big in the inflection. And so, I think you're going to see music. You're going to hear intonational patterns. You're not going to hear first words. You're going to hear first phrases. And people are going to be like, he's so smart. He said like, something from a show, and there'll be a whole line and you're like, oh, this has nothing to do with intelligence. This is how he's processing language, and it's in a chunk, if you will. So very interesting stuff, isn't it?
Yeah, it is. That's for sure. All right. So when should SLPs consider introducing AAC?
Okay, so my main thing about AAC is that it should never, ever, ever be considered a last resort. Again, I'm a seasoned SLP. So when I went to grad school in the 90s, I really feel like, I don't know that we were specifically taught that, but I will tell you, we weren't proactive with AAC. It was more of he's been in speech for a year. He still doesn't talk. Maybe we should try to, and back then, gosh, in the 90s, I mean, we didn't have cell phones. So you know how clunky the devices were. I mean, so we are so blessed right now to live in the digital age where, I mean, gosh, you can get, the Pro Low Quota Go, you can get it on your phone, your iPad, right? There's apps. So the main thing about AAC is to recognize that AAC is not a last resort, and it is not only for our non-speaking or minimally verbal children. It is so important to recognize that even children who are verbal, you don't take AAC away once they become fairly verbal, because there are times where they are going to have some either anxiety, maybe social anxiety. There might be some times where they're pretty dysregulated, okay? And they just cannot use their spoken words. So they need to have what we would call unrestricted access to AAC. And that should not be taken away when they become verbal. So just recognize that there are, and this is what I've learned from listening to autistic adults, is there are autistic adults who are like, oh, I talk. I mean, when I'm in the mood, but I also sometimes am like, I'd rather just use my device right now. I'm not regulated. I have so much stress and anxiety right now that it's easier to use AAC. So it was interesting for me to think about the fact that, oh, even verbal kids can benefit from AAC. So other than it not being a last resort, the most important thing to recognize that it should be robust AAC. So bye-bye PECs. We are done with this. I want a cookie, please. This robotic speech. This sixth grader that I went and spent time with, I'm not kidding you. He sounds exactly like a robot. He's been PEC'd to death because the only phrase he uses is, I want a. Do I not sound like a robot? I mean, it is so, and he'll just look right at you. I want a cookie now, please. And it's like, whoa, like it's just so, and PECs is not robust. So what do we mean by robust, right? Robust means that it should incorporate literacy, right? Goals for literacy eventually. It means it should have a full keyboard, access to a full keyboard. It should be always available. You want to follow on Instagram the AAC coach. So it's AAC coach. I mean, she's just phenomenal. You want to get all your information. I mean, she's just so brilliant. Robust AAC should have text prediction. It should have an option to put entire phrases and sentences in. So those high frequency, like what's your name? The child should be able to hit one button. It says, my name is Carrie. I'm 10 years old, right? Instead of having to type every single and find all the buttons. If the child has any motor planning struggles, dyspraxia, apraxia, LAMP, Words for Life. LAMP is the best because it is designed to support motor planning. So just make sure it's robust. You can go to the AAC coach, and I know there are tons of others as well, but she can give you, some recommendations. Touch Chat is one, Proloquo to Go, LAMP, Words for Life. So there's several that are really, really great, that are robust, that are fairly easy to use. The one thing that I think is important to recognize is when we only use AAC for requesting. So, does he use his device? Does he use AAC? Oh yeah, he tells us what snack he wants, or he tells us what he wants to play with at circle time. Okay, so I was actually sitting in a meeting with all these teachers, and I said, so let's think about this. The only time he communicates and initiates communication is to tell you a need, like I have to go to the bathroom, I'm hungry, I'm thirsty, or to make a forced choice. So it's to request and to make a forced choice. So what if I told you that was the only time you're allowed to talk? Okay, the whole day, you're only allowed to talk if you're making a request or if you're making a forced choice. Do you want broccoli or carrots? Well, I don't want either one. Well, you have to make a forced choice, right? So you're forced to pick one. But if that's the only time I allowed you to talk and gave you your voice, you probably wouldn't say much in the day, would you? You wouldn't have very many opportunities to practice using your device when we hyper focus on using the device for requesting. So that is why we want to make sure that we're really thinking about the variety of ways that we, functions of communication. That's what I'm trying to say. Look for the variety of functions of communication. And the last thing I'll say about AAC, it's never too soon. You don't ever say, oh, he's too young. Research, Davison came out in 2017, said research, they find that for children who are struggling with communication development, 12 months is the best time to introduce AAC. 12 months. Okay. Wow. So it's never too early. We don't say he's too young. And as Kate from the AAC coach says, don't talk to me about prerequisites. There are no prerequisites for AAC, because what we're going to focus on early on is we are going to model use of the device without any expectation for the child to do it. So we're going to actually, if you will, just like we become the child's voice when we're teaching them to talk. Child pulls on his mom's shirt and I say, up, mama. I don't say up, mama. I say it from the child's perspective, up, mama. And that's how the child learns. Well, same thing with the device. I'm going to use the device and show the child, like, Sam fell down. And then the device says, Sam fell down. And so it draws, the child's attention to his classmate who just fell down, and he's hearing the words, through his device. So lots to learn about AAC.
Yeah. Well, I mean, you gave a really great, brief summary. And then we do have Kate. I actually spoke with her earlier this morning.
Oh, really?
The AAC coach. Yeah. So we'll be featuring her as well. And it might come out before this. So it'll be a nice segue. They've learned a little bit about AAC, and then they get to dive into yours as well.
Perfect.
And then one thing we had, I did mention this, that we had Alex from Meaningful Speech. She talks about Gestalt language processing. And when you were talking about the goals for requesting and basic needs, she called it survival language. She's like, that's survival language. That's not
I
functional
love it.
language. And I like
Yeah.
how she said that because it's so true.
Yeah, if you're only focusing on basically bodily needs, I have to go to the bathroom, I'm hungry, I'm thirsty, I'm hurt, I'm sick. Yeah, I mean, okay, there's more to express in life than how your body is doing, right? So I like that survival. Yeah, that's great.
Yeah. Oh my goodness. That went by super fast, but it was so amazing. Is there anything else that you wanted to share before we wrap up today?
Oh, no, I again want to thank you for inviting me. I really love talking about this. It hits home for me since I have an autistic son. So thank you for the opportunity to share. And I am excited to just continue learning as we all are right now, learning and learning, right?
Yes, yes. And I'm just so grateful that you agreed to do this and that you keep sharing all of your wonderful resources through your social media platform. So, is this the best way for people to connect with you?
Yeah, but they can also go to my website, which is just carrieebertseminars.com. And that way you can learn more about me and what I do and my services. I have a ton of ASHA approved self-study courses on there. I have a ton of products available. So yeah, go to my website as well. But yes, Instagram is where I do daily posts related to early child development. And they're almost always either about autism, apraxia, play-based learning. I mean, those are pretty much the three topics that I harp a lot on. So
Wow, I didn't know you post daily, but I know you post a lot and
every
it's super
morning.
fun to
Yep.
watch. That's
Every
awesome.
morning. Yes, absolutely. I enjoy it.
Well, thank you so much again, Carrie. And then we will include this handout and it'll have like some of the talking points that we went over today and references on our platform. So I appreciate it and hope I get the chance to speak with you again.
Yes. Thank you so much. Take care.